I'm going to be your student nurse for the day. I did wash my hands before entering. Could you state your name and date of birth for me?
Karolina Oronowicz, 5/31/69.
Okay, great. And do you have any allergies at all?
No.
So none to environmental exposure or food, any medications?
Well, the only thing is, I think I'm allergic to cats.
Okay, what kind of reaction do you get when you are around cats?
Just sneezy,
Runny
nose, and sneezing.
Okay. So nothing too severe when you're around?
No.
Okay, great. And so next I'm going to assess the patient's orientation. Could you tell me where we are right now and what we're doing?
Well, I am in my own house, and you are doing a checkup on me.
Yes, and what is today's date?
Today is November 20th.
Yes, and what is the year?
2020.
Yes, okay, great. And so then I'm going to start by assessing your heart rate and respiratory rate. So I'm going to locate your radial pulse.
I can take my watch off.
Yep, that might help, thank you. Okay, so the pulse is graded at a 2, and I'm going to go ahead and take my stopwatch. And I'm going to count for 30 seconds and multiply by 2 since it is regular as well. Okay, so I counted 44, which brings us to 88 beats per minute, which is within normal range. And then I'm going to reset my stopwatch for another 30 seconds, pretend like I'm still taking the patient's pulse, which I normally would not say, and watch her chest rise and fall for the respiratory rate. Okay, so I counted 7, which brings us to 14 breaths per minute, which is also within normal range. And now I'm going to start by inspecting your abdomen shape, if you could lay down for me. Now, normally we would have the patient lift up their shirt to expose the abdomen, but for the purposes of this video, we're going to have the patient remain clothed. So the patient's abdomen seems to be, upon inspection, its shape is flat, and I don't see any scars, no discoloration, hernias, or any protrusions or masses. So the abdomen seems symmetrical. So I'm going to go ahead and auscultate with the diaphragm of my stethoscope, starting in the right lower quadrant, and we're listening for any gurgles or abdomen sounds. And we're moving in a clockwise motion up to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. Okay, so I did hear some gurgles, which is good. If the sounds were absent, then that would indicate some sort of obstruction in the abdomen. And then I'm going to go ahead and percuss the abdomen, again starting in the right lower quadrant and going clockwise. Okay, and it was mainly tympanic. We heard tympany, which is good, which means no obstructions, some dullness, but that's okay. So then I'm going to go ahead and start with the light palpation. Again, starting in the right lower quadrant, and let me know if you feel any tenderness or pain at all. Any pain?
No.
Okay, so then we're gonna do the deep palpation using both of my hands. Again, let me know if you feel any pain.
No, so far I don't.
Good. Any pain there?
No.
Okay, great. So then I'm going to have you sit up while I assess your abdominal tone. Seems to be good. Patient didn't seem to be in any discomfort. No hernias or protrusions when she was sitting up. And then I'm going to assess for CVA tenderness. If you could face the wall for me. And I'm going to place my hand where the left kidney would be first, and let me know if you feel any tenderness at all.
No.
Okay, and then bilaterally. No, any tenderness? Okay, perfect. You can turn back around, so no CVA tenderness, which is a good sign. And also when the patient walked in, I did assess her general status. She has good posture, she seems to be in no distress and has good hygiene and is properly dressed for the weather, which is all good signs. So do you have any questions or concerns for me at all?
No.
Okay, great. Thank you for coming in today.
Thank you.